माय मोगाचो येवकार सगळे आमचे CCR TV पळयणाऱ्यांक ए ग्रँड वेलकम. आयचो आमचो टॉपिक जावन आसा डॉक्टर वायझमॅन्स आमची भलायकी आमचे हातांत. तर आमी हो एपिसोड हो जावन आसा दुसरो एपिसोड. पयलो एपिसोड गेल्ले सुमाराक तुमकां पळोवंक मेवला आसतलो आनी आयचो एपिसोड आमच्या मुखार आहा डॉक्टर वायझमॅन पिंटो. डॉक्टर वायझमॅन, वेलकम. माय मोगाचो येवकार तुका.
Thank you. Muito obrigado. Deus bem coro. Mr. Jovito, for inviting me.
It's a pleasure. It's a pleasure.
Obrigado.
And we finished with episode 1 yesterday when we talked about the general aspects of health.
Of health.
Yeah, it's not only absence of disease,
Correct.
but we said
Good health.
Good health, your happiness,
Positive, right.
positive health. So today, doctor, we will talk about the non-communicable diseases, and there's a lot of load, and we will talk about a new problem that is arising of heart problem, and that's your cardiac arrest. People know about heart attacks, but of late we are seeing a lot of cardiac arrest. So what is this, what we call it as the heart attack? What are the causes, the precautions, the prevention, and all that we can talk. Because in America, in the United States of America, they say that every 34 seconds, there's one person who dies of heart attack or heart problems. So, Dr. Wiseman, what is exactly this heart attack, and is there a difference between heart attack and cardiac arrest?
Right. Now, Jovito, heart diseases have become very common. As you rightly said, non-communicable diseases. So that includes heart diseases, diabetes, hypertension, stroke, cancer. These are not communicable. These are diseases due to different lifestyle. Now I'll give you one. So what's the difference of communicable? Communicable means, for example, tuberculosis. It is caused by bacteria, mycobacteria, or COVID caused by a virus. But heart attack or a heart disease has multiple risk factors, or cancer has multiple factors. So all play a role in causing this disease. So now let us see the heart. You know, heart is required to pump the blood at all times. Once the heart stops, the person can survive for a few minutes, but then he will die. So the heart is made up of muscle, which is called the cardiac muscle. It cannot regenerate. It cannot divide. Similarly, brain cells cannot divide. Some other cells divide. So that's why when you get a heart attack, that tissue is dead and it is replaced by fibrous tissue, granulation tissue, like healing. If you get a wound, there is healing. You know, there's a granulation tissue like an ulcer, and then fibrous tissue and fibrosis. So there's not heart which is replaced, it is the fibrous tissue. Now see, so what is this MI? What is this myocardial infarction? Infarction means lack of blood supply. So if the heart is deprived of a blood supply, blocked arteries, then there is a MI.
Yes.
MI is heart attack, myocardial infarction. Infarction, right. Now how this artery, which are the arteries? There are coronary arteries. Coronary which supply the heart. There is the left coronary artery and right. Left is more important because the left ventricle pumps a lot of blood. So if this is blocked, LAD it is called, left anterior descending coronary artery. Most of the time this is blocked. This is blocked by what? By all atherosclerotic plaque. We will be discussing atherosclerosis also later on, but it's basically fat which is deposited.
We call that normally as cholesterol.
Cholesterol,
Yes.
yeah. Now fat includes cholesterol, fatty acids, high density, low density fatty acids, and triglycerides. So they all fat, yellow in color. So that gets deposited and blocks. So first it's a blockade is minimal, then it becomes more and more, say maybe 10%, 20%, 70%, 95, 100%, and then it blocks. And then blood supply is stopped of that part is called a heart attack. So this is the pathogenesis of heart. Mostly it is left ventricle, left anterior descending. Sometimes it is right coronary also, sometimes, or circumflex. So this is a 3. Now they get blocked means due to, as you said, lipid, fat, cholesterol, atherosclerosis. These are the people who have risk factors. Now the risk factors are what? There are many risk factors: diabetes, hypertension, smoking, sedentary life, no exercise, lot of stress, tension, and then others are, unhealthy foods, unhealthy narcotic drugs, alcohol, smoking. These are all the risk factors.
So these are basically lifestyles.
Basically lifestyle, and these are
lifestyles.
common for everything.
Yes.
These are common even for atherosclerosis, for diabetes also. So this is one thing. Now I would also like to add here that research is giving new lifestyles, new risk factors. One is, Mr. Jovito, many old people are lonely. Loneliness is a risk factor.
For heart
For heart attack, yes, for all these, for these diseases, for heart attack, for strokes, loneliness. It is equivalent to smoking cigarettes. So bad it is. So loneliness, depression are risk factors, which are the newly described risk factors.
Yeah, because there is something new that.
But it is described, and it is like smoking cigarettes.
Okay.
It's like smoking cigarettes. Depression. Now, of course, we discuss atmospheric pollution, global warming, and mobiles, screen time, children, the computer. So these are some of the factors.
And also, doctor, it could be also genetic.
Genetic is very important. Family history.
Yeah, your father, mother.
Exactly.
Yeah.
Genetic is very, father, mother. So this is a heart attack.
So that means you will have to select your parents who have no health problems.
Jovito, I'll tell you a joke. People ask me, how your name is like this? I said, I never gave my name. I did not select my name. It is selected by my parents, grandparents, etc. So this is one. Similarly, we cannot select our parents.
Yeah. Because if you are father or
mother. Now, as you rightly said, if there is a family history, you have to be very careful.
Yes.
Now, I am going to.
So you take a greater precaution.
Start the screening at a younger age.
Yes.
Younger age.
Yes.
You follow. Now, as you rightly said, family history and narcotic drugs, all this. Now, I'll tell you, we have done, I was fortunate because I was the head of pathology, and lot of post-mortem. Goa is all coming to the Goa Medical College. Some are done in South Goa, but majority Goa Medical College. So I'll give you some instances of heart attacks which changed the course of the disease. As I told you yesterday, the previous day, that a young 22-year-old guy, he was a gym instructor,
yes,
South Goa.
We shared that example.
We shared that.
Yes.
He suddenly got pain, collapsed, and within half an hour, he was dead. His post-mortem, because there was a lot of violence,
yes,
agitation,
yes,
because people thought he was not treated properly by the...
actually, the father of the victim went to Azula Hospital.
Auspicio
in Margao.
Right.
And he slapped that doctor.
You're right. All this, there was agitation.
Yeah, and he says, you did not treat. And are you telling me that a youngster in 20s, he had a heart attack?
Yeah. And the people who were agitated broke a lot of furniture of the Portuguese days.
Yes.
Anyway,
yeah.
Then a panel was formed. The post-mortem was done. I was the chairman. And it was found. And this is something which is documented by videographing, photo. The heart, the coronary was totally blocked. Totally blocked. And I have the photos. I have presented it. It's there on my e-book also.
Okay.
Yeah. So just to tell you, finding out the history, the boy told his family he had pain. So they thought it was acidity. And he was given treatment for that. But the doctor had told him to do an ECG. Probably he didn't do. Now, so young guy.
The old way of thought process.
You will get all right.
Gas bhi jata.
So then I went into the depth of it. Those who are doing gym, the problem is, they are stressed. They take steroids. They take hormones. to build the body, lot of protein, steroids, so your appetite is increased, so lot of eggs, protein to build the body, but it has harmful effects also. So this is the harmful effect. Now I'll tell you, during Konkani agitation, there was Bandh, and one of my cousins told me his neighbor was a bodybuilder from one of the villages, and he said, "Arey," his father said, "Arey, it is blockade. I can't get eggs. I can't get chicken, which comes from Belgaum. So munge putha to." He needs all this because he is doing bodybuilding. So just to give you an example, how much they eat. That's the time I realized they have so many eggs, 10 eggs a day, chicken. To
Yeah,
to build,
they have to build.
they have to build the
muscle.
body.
No?
So similarly, so this is gym. My advice to the people who use the gym: you build your body naturally. Do not take supplements. Do not take steroids, growth hormones. These type of powders.
And chod shed whey protein one dita.
Whey protein. So they should not take much content, because this is one thing. Not only here, in other places also, Delhi, while doing the gym, they have collapsed and died. Now, so this was one case. Then there's another case, young patient, young fellow who's come with his friends for a holiday from Bangalore. They are going, they drink, they might be having narcotics, etc., etc. Get tired, collapse and died. Again, young, 25, heart attack, blockade. Then you ask the history, was he this, was he that, hypertension. Then usually they don't know, the family doesn't know. So anyway, they are in disturbed state. So this is two. Then third, I'll tell you still another story. This story 20 years back. I was a young doctor. A boy who was in college in Ponda, in the ground while playing, collapsed and died. And he was brought, and his coronary artery showed one disease called as polyarthritis nodosa. It's a collagen disease which also blocks the coronary artery. So at that time, I was lucky to get the microscopy of it, that there is vasculitis. Because I see very meticulously post-mortem, the whole body is with you, you see each and every organ. So, and you examine it. So there was polyarthritis nodosa. This is a collagen disease which has affected the artery, and poor fellow, he didn't know it, it was blocked and he died. So this is another example. I'll give you still another example of a young fellow who died in Kalangut. He was in a room, he fell down. Everybody, when young people die, they think that it is narcotics, alcohol, they think. Now this person was a Goan, and his mother came to me, and 2-3 times, to hasten up his report. But the Jovito, the story is like this, that we are doing histopathology of living people and also the dead. So living, we give preference because they have to be operated, they have to be treated. Dead can wait for some time, but we have to give the report. So she met me another time, second time, third time. Then third time she met me in the lift down. She said, "Doctor, you will do a great favor to me and my son if you do his report fast." So I went straight back to my department and saw that it was done. It takes days to process. So I got it done. And what to tell you, the disease was a heart disease. It's called very rare, hyper QT syndrome. Short QT syndrome. QT is the ECG waves. Short. It's a congenital hereditary.
Okay.
Then I diagnosed it. She was so happy that, I gave her the correct diagnosis. She took the thing for gene analysis in Delhi, or I don't know the follow-up after that. And then we published it, we presented it. And she told me, "Doctor, you have solved one of my mysteries." She said, the house we come from, somewhere North Goa, I am not mentioning, they used to say, "En Goru Papiyan gele." Papiyan means sinners, house of sinners. All the men used to die in their 20s. In the 20s, it's a genetic disease. So it was diagnosed, fortunately, by the post-mortem, by me. And short QT syndrome. That, what happened is that, so, her mystery was solved. not only the historical mystery of the house being called, etc., etc. And I felt a sense of, you know, having helped some people. Another time, one guy phoned me from Jammu. He was a central government employee. Son died like this in Kalangut, Baga, Vagator, for all. And he's saying, doctor, and started shouting at me, shouting that you're not giving the report. The tissues had not come to me. They have to come to me. Police has to bring it. Yeah. They did not bring it. So, but I then thought to myself, I said, this man is having a problem. Means people are, you know, he has lost his son, young son, and people are saying drugs and this, alcohol. So I said, I talked to him very politely. I never shouted back at him. This is how you learn that different, you know, how to handle stress, how to handle anger. So I told him that I'll just find out. So I phoned my forensic guys, the fellow who did the postmortem. They found out. He said, doctor, sir, no, they call me sir.
Definitely.
They're all my students.
Yeah.
So he said, sir, the police has not brought it. I'm going to tell the police. Police finally saw that it was there only. So finally they got the reports and he gave. So just to tell you that heart disease has changed, that from older people it can be seen in younger. Now, Mr. Jovito, after I saw these young people, I started wondering, is it in India, is it in Goa only, or is it in India, America? Because I've got contacts in US.
And you have traveled to so 50 countries.
Yeah. So
in all 5 continents.
Exactly. So I asked my friends in Delhi, All India Institute, who does heart pathology, KEM, who does cardiac, he does only cardiac pathology, they're experts, and Trivandrum. So they said, sir, we are also seeing, they're all younger than me, so we are also seeing young patients with MI. Our cardiology department also is seeing young patients with MI. So the thing matched that these are the risk factors. Now, Jovito, I'll tell you one more. America doesn't see that much. I sent a message to my relation. He's an interventional cardiologist, St. Louis, Missouri, Keith. He said, no, sir, no, we don't see that often. So that, then, why it is so? We Indians and Asians have something known as metabolic syndrome. We have congenital predisposition to a metabolic syndrome. Metabolic syndrome means you have heart disease, MI, diabetes, hypertension, and these diseases because of certain genetic and epigenetic factors. Now, how they have occurred, you know, Mr. Jovito? India, during British days, there was famine. I don't know if you know.
Yes.
Bengal, Orissa, they were not giving the food to the Indians, and they were sending it for the troops in the war. So because of that, the Indians gene on epigenetics, I'll come to epigenetics later on, got changed, mutated, and that is why the Indians and Asian more prone to this metabolic syndrome. That means there is insulin resistance followed. Now, I'll just tell you very briefly what is epigenetic. You know, genes are in the DNA, mother and father. There's something called epigenetics. That means around that gene, there are like sulfide, methyl, methylene, there are some bridges. So that is called as epigenetics. That is also very important, because two twins may have the same genes, but they have different disease. This twin has got leukemia, that twin doesn't have. So that is why they studied epigenetics, which is different. And epigenetics can also give you for cancer, Alzheimer's, heart disease. So that is why I told you why Indians are predisposed. So then I thought that we are absolutely on the right track. So people have to be counseled, to be told, public knowledge. So I did a e-book on this, it is still there. I did seminars on this for public to know that the Goan public should be careful.
So the Goan public should be more careful.
More careful.
Yes.
Especially those, as you said, who have a family history.
Yes.
Even otherwise.
Yeah.
Those.
So basically, Dr. Wiseman.
Yeah.
Would you suggest that periodically at certain age you do certain tests?
Yeah.
And are these tests available today in Goa?
See, Mr. Jovito, we know that it is diabetes, we know this hypertension, we know that it is the lipids, bad lipids, we know all this. So naturally we have to see if this young person, say by the age of 25 or 30, you have to do your sugar, your cholesterol, your lipid tests, low density lipoprotein, high density lipoprotein, VLDL, triglycerides, that's called a lipid profile.
Yes.
Sugar, kidney function test, uric acid.
Yeah. So
these are all available in Goa,
Yeah.
in Goa Medical College.
Yeah.
They are done
Plus-
in our central laboratory.
Yeah. Plus today there are so many laboratories.
So many laboratories all over Goa,
Yeah.
full of.
So you would recommend?
I would recommend these
At
tests.
what age to start with?
I feel we should start with 25.
So at 25,
At 25.
you
See,
have.
because I'll tell you why. Usually, when they go for a professional course, they usually do a medical test,
Yes.
a professional course. After that, they don't do. There's a medical test which is called medical fitness. They see your eyes, your pressure, your pulse, all your things, heart, and some blood tests also. So I recommend 25, then 30, and every maybe 5 years.
So every 5 years.
Yeah, I recommend.
You check for blood sugar.
Yeah.
You
Lipid
check
profile.
for lipid profile. Your
Yeah.
blood cholesterol.
Cholesterol,
including triglycerides.
Triglycerides.
Yeah.
LDL, VLDL.
Then blood pressure.
Blood pressure also.
Yes.
Blood pressure.
Yeah.
All this should be done.
Yeah.
So basically,
every 5 years.
yeah,
if
every
it is
5
done,
I would
then
recommend.
you know exactly.
For the males.
Yeah.
For the males.
And
For the males.
Okay. And
Females may be little lesser. I'll tell you why.
Yeah.
Females are protected by their hormones, but once they get menopause,
Then
they get heart attack.
is it the estrogen?
Estrogen,
Yes.
absolutely. Estrogen is which is protective,
Yeah.
and then they.
But there are some.
But I think that the women also should be.
Yeah, there are
test.
some who also say that it is recommended to do the ECG,
Yeah,
electrocardiogram.
yeah. See, basically, Mr. Jovito, besides, before doing the blood test, you go to any doctor.
Yes.
The physician is better. They will check your pulse, your pressure, and after that, they will ask you certain tests, like some blood tests, which we have said.
Yes.
Second, ECG.
Yes.
Then third is they will also some chest X-ray. These are the basic tests. Now, I would not recommend them to do any of those enzymes. Like there are cardiac enzymes,
Yes.
troponin,
Yes.
and only if there is pain or something, not on a routine basis. Followed. So from ECG you can see the size of the heart. From the chest X-ray you can see if there are changes in the lungs, heart. So this, according to me, is sufficient.
Yeah, but this basic test.
These are baseline tests.
Yeah, so baseline
Yeah.
test should be done every 5 years.
Yeah, with going to a physician and then going and doing these tests. And more so if you are having a family history.
Yes,
in your family.
much more.
If you are a smoker,
Yeah.
if you drink, and narcotics. And so all these things which and if tests are abnormal, then you have to follow. Now, Jovito, I'll tell you one more thing. All these young people who are having heart disease, heart attack, it is a big social problem, economic problem. Not only to them, for their jobs, for their families, for their friends. You understand? It is a lifelong problem.
It is.
So it is better to avoid it, reduce it. Now, I have been fortunate that at autopsy I can see, and there is no question of this or that. It is 100% that it is coronary artery. Now, I will tell you one death meeting which took place. This is just by the side. We discuss deaths in Goa Medical College every month, which died during that, and anybody can ask questions. So this story is about 20 years back. Now, there was a patient from medicine who had, and the diagnosis given by them was MI. As you are asking me, MI is myocardial infarction.
Yeah.
And then a postmortem was, sometimes postmortems are done, cause of death not given or some suspicion. So those postmortems are very beneficial to study, to research. For us, not good for the other people, etc., but for us. So there I diagnosed that there was myocarditis, means inflammation. Now, one senior physician, I don't want to talk detail, he's asking the chair was the dean, what is correct? Myocarditis is final or the ECG MI? This is common sense. This is common sense, medical common sense. What you see under microscope is a final. Is final. Your ECGs or your may be decided, as they were accusing. The father was accusing. But when you see under microscope, that is final. That is final. You see inflammation in the myocardium, and I showed the photos also. We presented that.
Yeah, sometimes also they say that ECG may not give you
exactly.
the final.
Now, I'll tell you two things, Mr. Jovito. When you have a heart attack, the symptoms are severe chest pain, retrosternal, very severe. They will say it's a choking pain, very severe, gripping, radiating to the arm, shoulder, neck, because of the nerve supply. And then sometimes there is a shock, and sometimes there is arrhythmias, etc. So these are the things which can take place. But in diabetes, nerves are damaged, and it is a silent MI. Without pain, you are having a heart attack. So as you rightly
said, because of neuropathy.
Because of neuropathy, yes. Autonomic neuropathy. Yes. Absolutely right. Autonomic neuropathy. So you don't get pain. It's called a silent MI.
Yes.
So those type of patients. So we have to be, and as you rightly said, ECG may be normal. So that's why they do ECG and the enzymes.
Yeah. And then they talk about EEG and the stress test also.
So exactly. Color Doppler stress test. You know, nuclear stress test. Nuclear isotopes.
Are these tests available at a GMC?
In GMC, we don't have a nuclear medicine person, but Manipal, Goa has a nuclear medicine. One doctor is there. He's there for a long time. Okay. He's given a talk in our hospital also. I had invited him. So in Goa, Goa Medical College, nuclear medicine is till now is not there. Nuclear medicine, but it can be diagnosed. And then if there's a problem, now we have a full-fledged cardiology and cardiac surgery, which is running 24/7.
And I was told it's one of the best.
It is a very good center.
Yeah.
Now, if you want to go into the history, that's another big story. See, I have seen medicine, cardiology or otherwise, or pathology in Goa from 77 till today. So many cardiologists came and went, but nobody could start this cardiology. I would actually give credit to two persons for starting this cardiology. Now, who are the two persons? I know it, people, because I am seeing from inside.
Yes,
you know
better. You know better.
Before that came Raut Desai.
Yes.
Poor fellow is no more. You must be knowing Dr. Raut Desai.
Yeah.
Before that, after that came Kane, Dr. Kane. After that came Babu Desai, P.V. Desai, Purushottam Desai, a very brilliant. But he could not, because there are a lot of bureaucratic tangles and obstacles. They all tried. They even wanted to have a PPP, public-private partnership. I was a part of all this. They were trying to get vivas, they were trying to get people from Bangalore, people from here. Nothing worked. Nothing worked. God blessed Goa in two ways for this cardiology. Dr. Guru Prasad Naik, a cardiologist who was in US, his father was here. He died last year. So he died at 90, also a doctor, prominent doctor in Seoul. So he wanted to come to see him. And he wanted, and Parikar was his relative. So that is the reason Mr. Manohar Parikar and he got whatever he wanted, whatever equipment, whatever salary, whatever nurses, because they are all specialized nurses. The nurses who are there are not the ordinary nurses. They are cardiac trained, cardiac anesthetist, cardiologist, cardiac surgeon with high salary. Nowhere in India it is like that, in a government setup. So I would give the credit to these two, Parikar, Mr. Manohar Parikar and Guru Prasad Naik. Then of course came our, who died, poor fellow, Desai, Manjunath, also very dedicated, very dedicated. And the team which is there today is also very, very dedicated. Both cardiac surgery, cardiac anesthetist is very, very good. He's DM, all of them. You followed. So he's also. So they are all very good. Then I'll again tell you, of course, now Mr. Vishwajit Rane, our present health minister, expanded the cardiology, brought more and more units, etc. And even started this thing called as STEMI, so that if you have a heart problem, chest pain, you go to the primary health centers, they give you the injection, they take your ECG and send it to Bangalore. There is an app.
Is it?
Yes. There is an app called as STEMI, because the first 1 hour is very crucial, and they tell you whether to give or not to give. You followed, because these the people in the health centers are MBBS. You followed.
Yeah.
So you get it, and then only they inject, lysine enzyme injection, and then they are brought to James. So I would say that this is the history. God has blessed Goa by giving a good cardiac surgery, cardiac anesthesia, and cardiology.
Yeah, but basically it is the stent surgery which is...
Yeah. No, there are two types. One
Okay.
is, the stent is done by cardiology. They do an angiography,
Yeah.
and they put a stent.
Yeah.
If it is required.
And I believe that in 24 hours...
Yeah, soon.
You
Same
can walk.
day, you're back home.
Yes.
Yeah. Now, cardiac surgery is when it is a bypass. It's a very big surgery,
Yes.
which is a
Somehow it is open heart.
Open heart, you're right. That's
Yeah.
called as open heart surgery. So
Yeah.
that also they are doing here.
Yeah. But this cardiac unit, I
Yeah.
was told
Yeah.
this is one of the best.
It is one of the best. It is the best. They have done the largest number of cases. In the research also, I was in charge of the research of the Goa Medical. They wanted to enter the trials for congestive cardiac failure, for heart. So they are doing very good work with good results. Though I have retired, I have to still get phone calls, and I still have to, I serve society, and I still telephone. So there was a patient from North Goa, a friend of mine phoned me, he said, Doctor, just see, he had an aneurysm. Aneurysm.
Okay. Yeah.
Aneurysm is the most dangerous thing.
Very dangerous.
Very dangerous. But ruptures means...
Yes.
So I telephoned Dr. Shirish Borkar. He picked up my call. In fact, he phoned me within 2 minutes. He didn't pick up my call. Within 2 minutes back, he said and explained to me, Dr. Wiseman, this patient is very serious because kidney is failed, and then his pressure is already low. If I operate him and give anesthesia, he will die. So so I explained to the family. So this is very important, that all these things one knows exactly.
But aneurysm cases now are on the rise.
So Jovito, aneurysm means dilatation of the aorta. It's not common.
Yeah.
But those with atherosclerosis have many complications. One complication is aneurysm. They are not on the rise, but they are diagnosed because of imaging, no?
Okay.
CT scan, MRI.
So because of that, you come to know.
You come to know. Otherwise, in the old days, ruptured, died.
Nobody
prime
knows.
ministers, presidents,
Yes.
they died of a sudden. Nobody knew. In 62, 67, 68.
Yeah, the technology. no?
Technology
This
has
is-
massively expanded.
Yes.
So that is one more thing which I just wanted to share with you,
Yeah.
and with the listeners,
Yeah.
that this is the technology, how it is rising.
So, but there is today in the GMC, there is very good, excellent technology
cardiac,
and
excellent.
excellent doctors.
Excellent doctors and excellent. The hospital there, Mr. Jovito, is like a 5-star hospital.
Is
like
it?
a 5-star, the super specialty block. Of course, it is the Prime Minister's funding. It is there in all the cities of the country, in the medical colleges. I've seen it in other places as well. It is a super specialty block. So there are super specialists there, and cardiac is one of the much required.
Yeah, now they say that after the United States,
Yeah.
we have got very good technology and very good doctors also.
Very good doctors, very good nurses, and very good care.
Yes.
Yeah, and very good environmental surrounding. And from top, you can see beautiful sceneries of
all
Goa.
over.
All over Goa. That side Basco, this side,
So now, once you get a heart attack, then you know where to
Yeah,
go. and
exactly.
Now, what is more of a concern for all of us?
Is
how
prevention.
to prevent?
Prevention.
Yes.
So now, as I told you, Mr. Jovito, prevention is by doing regular examination by the doctor, going to the doctor, doing a regular checkup, investigation, blood, as we discussed,
Yes.
X-rays. X-ray you don't do every time, ECG you followed, and all this, and then accordingly.
Yeah. So you carry out this test.
Yeah. There are even imaging tests, like nobody does it on a
Yes.
routine basis,
Yes.
like nuclear scans, or there's a cardiac also, which can detect cardiac MRI. But that has got some sort of you have to reduce the pumping bradycardia, so it has some sort of risk. So that is done. Plus you have got now one more stress test. You have to do stress.
Yes, stress test. But they talk about EEG, electroencephalogram,
with stress.
and with stress.
With stress.
With stress. Now these are available all over the Goa.
All over Goa.
Yeah.
All over Goa means big.
Yes,
big.
in
Where
big
there are
places.
cardiologists.
Yes.
Yeah, cardiologists, there are two types. DM is for this physicians who do the angiography, angioplasty, and MCH who do the open bypass surgery.
Because very often.
And remember, anesthetist has to be very good, because and technicians have to be very good.
Yes.
So these are all brought, paid on contract. Nowhere in India, this is what. So it is
very often people are advised you have to do exercise.
Yeah.
And very often the doctor says don't start doing tomorrow.
Yeah.
Please check your heart first.
Correct. See, now you might have noticed many football players and all suddenly collapse and die.
Yeah, we had the example of Cristiano Jr.
Yes, football. Dempo.
He scored the second goal in the finals against Mohan Bagan in Bangalore. He collapsed and nobody knew what to
do.
But we conducted a post-mortem here in Goa, and then they said it was cardiac arrest.
Yeah. So now, Jovito, coming back, sports, football and all, dances. Medical
you
ball,
have this, Zumbas and
exactly,
the new dances that have come. Vigorous.
Now, as you rightly said, sometimes what happens, these people, their heart, because they are exercising, is hypertrophied. So the blood supply is not enough. So that's why they get it. That's why you need a defibrillator.
Yeah, AEDs. Your automated
defibrillator. Like I had gone to Sweden. I told my wife, outside the palace this is a defibrillator.
Yes.
And so our government, our Minister Vishwajit Rane wants to, he reads my articles, by the way, and wanted to bring a defibrillator for all houses. That is a bit too much, but at least in playgrounds or where there are
now for all international football matches, international cricket matches, unless you have two defibrillators, and now they say third one for the spectators.
Correct.
Until you have this defibrillator, you cannot start the match.
I see. Very good. It is correct. In fact, one of my relatives had come for a medical ball, which was in Taligaon Community Hall. So he told me about 10 years back. He said, there should be a defibrillator here. So
yes, it is very important.
It is correct what he said. It is correct.
Yes.
But not every flat or anything. It has
because not everybody
and can.
Now, when we talk of heart attack.
Coming back to your heart. So the first I told you is MI, myocardial infarction.
Yeah.
Second, during COVID, I saw after vaccination, myocarditis means inflammation of the heart muscle due to viruses, etc. Then that is called myocarditis. So then third is called you have a cardiac rhythm is there. So there is cardiac rhythm is abnormal, like you have ventricular fibrillation, heart block. These are electrical type of abnormality.
Yeah, because in the heart, there are two small
nodes.
batteries or
batteries.
you call them as
Absolutely.
nodes.
They are called SA node.
Yes.
And then there is a bundle. So they are like batteries which give you the stimulus.
So your heart can generate electricity.
Exactly, electricity. Absolutely.
So if the electricity is not there, irregular, then you have cardiac arrest.
Cardiac arrest.
So
right.
So basically, heart attack is your blockages.
Yeah.
And your cardiac arrest is your electrical problem.
Electrical problem.
And can this be detected by just checking your pulse, for example?
Yes.
More or less.
Yes. You can. Yes.
Not accurate.
Accurate because the pulse will be abnormal.
Yes.
Yeah.
So everybody should learn how to check the pulse.
That is correct. What you said is correct.
Yeah.
This is very easy, not difficult.
Yes.
Very easy to see the pulse. So what you are saying is right. We are not asking you to put stethoscope and check the heart.
No, without
pulse.
that.
You're right.
If you have irregular beats, that's what they say that it could lead to
heart attack.
Heart attack.
Yeah. Now one more thing. Now, so this is called as cardiac arrhythmias.
Yes. Irregular heartbeats.
In Bombay, there are guys. There is one Dr. Lokhandwala who is a total expert in only these irregularities. He's a cardiologist, but he doesn't do angiography. He sees this irregular. They had brought him to Goa.
They say that the Chinese medicine is all on the pulse.
On the pulse, they
check the pulse at different places.
You're right. Pulse and they're on the foot and the palms and soles. You're right. So this is about the different types of heart. Now, of course, small young people have a congenital heart disease.
That is a birth.
That is a birth problem. Now, so this is one. Now, atherosclerosis, I just want to add to you, atherosclerosis means this fat, as you said, cholesterol gets deposited in big arteries.
Yes.
Large arteries, not in small, large arteries. And coronary is one of the arteries. Now, see what happens in these people because of fat, etc. The process starts before birth.
Is it?
When the baby is inside, yes. When the baby is in the womb, as the baby is born, there are something called as fatty dots, fatty streaks, and then atherosclerosis. So it's a process which takes 30 years, 40 years. Like I have done so many postmortems. So we cut the cornea, we cut the aorta. You see, atherosclerosis. Practically most of the people who are 40, 50, 60, but I have seen beggars, post-mortem of beggars, there is no atherosclerosis.
Nothing. Is it because of the diet? So saturated fat. And Goans love red meat.
Exactly.
And red meat
is a cause.
And of late they also talk about the oil. That refined oil has got more of omega-6 than omega-3 and it is creating a problem.
Absolutely
and people do not know which oil to use.
I know. What you are saying is right. Absolutely right. So coming back to atherosclerosis, so it is all yellow in color, fat, etc. Now you will ask me that, see, atherosclerosis used to occur when a person is 40 years old, 50 years, but now we are getting young fellows. No?
Yes.
That is because it is accelerated, because of the process is accelerated, become faster because of their smoking, drinking, steroids, narcotics, food, no proper, all these reasons. So that is the reason it is accelerated atherosclerosis and you get this blockade in 22 years old, 25 years old. So care should be taken. Not only about going to the doctor, about everything else, your lifestyle, how you eat, exercise, walk or whatever. Then third is your diet, no smoking, no drinking, no alcohol, no narcotics, no steroids. And so like this.
So would you say that preference is much better for a vegetarian diet?
Yes, vegetarian diet is far better.
Yes.
But you can add fish to it.
Yes.
Fish, omega-3 fatty acids, egg to it. Omega-3 fatty acids, nuts, grains.
So red meat is
red meat means that includes pork, beef and
Goans
love
love all this.
No, it's not that they should never eat.
Sometimes
of course you can eat. Definitely you can eat.
Yes.
This is one more thing, Mr. Jovito. After COVID, lot of myocarditis was there in young people. I have seen autopsies also, and due to vaccine also I have seen. complication of myocarditis. And after COVID, there were clots, thrombosis in the arteries, in the veins, and in the brain, in rare arteries. And let me tell you, during COVID, after vaccination, there are 2 girls who have been saved by a very good diagnosis done by Dr. Teresa Noronha Ferreira and myself with Noel. Noel is from biochemistry. 3 of us, Noel was having exams. So Teresa asked me to see 2 young girls who were given vaccine with stroke. So we did their blood tests. We did properly repeated Noel, me and Teresa, and we saw that it was VITT, vaccine induced thrombocytopenic thrombocytopenia.
So this was...
They were saved. They were saved. They were saved because the diagnosis was made. They had thrombosis in the brain, in the liver, but they were saved. And today, because of the vaccine, they were young girls. And I asked Teresa a few months back, she said they're still on anti-epileptic drugs. They have survived.
But they have survived.
They have survived.
Because of the right...
because of the right diagnosis. Yeah. It's
yes.
not that I would like to... But this is before we knew that it came. Teresa and I had read literature of VITT before the COVID. Later on...
So your research has been fantastic.
Yeah, it has been ahead of the curve.
Yes.
You have to be always ahead of the curve.
We are running short of time. Dr. Wiseman, we talked about heart problems. We talked about heart attack, cardiac arrest. We have to continue because the same problems, if they arise in the brain,
correct,
then we call it earlier they used to call it the brain attack, now they call it the stroke.
So
we will stop at this and we'll continue.
We'll continue. Yeah.
It's very interesting. The research that you have shared is something new even for me.
No, I know. It's very good because I always believe that knowledge has to be shared. It should not be kept for yourself. It should be shared. You get blessings from God. And even though I have retired, I still share my knowledge. I teach. I see slides. I give opinions on the phone. I have a microscope at home. People come to my house. Yes, they come. Now slides are sent on the phone. Now I got a case of a doctor's son, 22 or 23, from a foreign country. I'm not naming the country because
I know.
People may not be happy to tell that I've given opinion.
Yes.
This was about 2 months back that there was a needle biopsy done, and some people said cancer pathologist in that country and some said not. So the photos were sent to me because I know he was a vice chancellor and the father of the patient is a doctor. So I gave the opinion that it is viral, and then biopsy was done and they said that I was correct. So that is why, just to tell you that I give opinion free of cost.
No, the best part of Dr. Wiseman is that you don't keep the research for you and within you, but you share it so that a large number of
more people are benefited.
Yes.
Yeah, and I'll tell you one more thing.
Yes.
2 minutes.
Yeah.
I told you yesterday I go to church, I'm a Christian, but in my delivery of patients for exams, students, my colleagues, my staff, I treat everybody equally. The poorest man to the richest. Governors have come, chief ministers have come, ministers have come, many over the years.
And I think, Doctor, sorry to interrupt you, I think God has blessed you because nobody will say that you have retired.
So it is like just continuing. And then I treat them all equal. Even for exams, I do not discriminate. Whether you are from UP, Bihar, Orissa, Goan, non-Goan, Hindu, Christian, whatever caste you belong to, I do not discriminate. I do equality. Treat everybody equal. My patient, my staff, the servant up to the highest, I treat equally. As well as the doctors in the university. That's all. So anyway, this is
that's why God has blessed you abundantly. I
thank you.
We will stop at this, but when we have the episode 3, we need to summarize especially for goans, because goans now are going into heart problems.
Correct.
Because most of the diet and the lifestyle.
Correct.
We'll summarize and then we'll follow it up with a stroke, because it is a similar problem.
We'll do
so
it.
Till then, bye bye, Dr. Wiseman. Thank you very much.
Muito obrigado.
Thank you so much.
Thank you. And Dev Baran koru.
Thank you.